There are still doctors out there, despite my years of YouTube harping, that won't check an A1C. Patients have to argue with their doctor. If they're, say, their fasting glucose is normal, their doctor won't say, well, why would you even want an A1C? Your glucose is normal. And the patient's reply is, yeah, but dude, I've been fasting for 12 hours. I could have prediabetes or type 2 diabetes and my fasting glucose still be normal. You know that, right, doctor? This is a literal conversation that some people have to have with a doctor who's behind on his or her reading. But then the average doctor, even today, after me being on YouTube for 5 years, yelling from the rooftops about check a fasting insulin, they're like, I'm not checking a fasting insulin. You're not a type 1. There's no reason for that. And so the patient has to explain to the doctor, as if the doctor is an elementary school student, why they need their fasting insulin checked, because it is indeed possible. Let's say, for instance, you're taking glyburide or glimepiride or glipizide for your type 2 diabetes or for prediabetes. So they work by actually forcing your pancreas to produce more insulin. That's how they work. Okay, it doesn't cure the diabetes or improve the diabetes in any way. It just makes you hyperinsulinemic. Well, if you just check a fasting blood sugar on somebody with prediabetes who's taking glyburide, their fasting blood sugar is going to be normal. If you check an A1C, it may just be normal or barely elevated. But if you check a fasting insulin on them, their fasting insulin may be 40 or 50, which reveals immediately that, number one, their pancreas is having to work triple time, quadruple time to keep that A1C as low as it is and to keep the fasting blood sugar as low as it is. Well, if a doctor has any common sense at all, they would say, well, why in the hell is their pancreas having to make so much insulin? Wonder what's making that necessary. And then for many doctors, the next logical step is, well, maybe if I tell them to cut back on the carbohydrates in their diet, their pancreas won't have to work triple time making extra insulin to push that glucose out of the bloodstream into muscle cells and other places. And so for many doctors, that's been their epiphany, is when a patient basically says, look, either check my fasting insulin or I'm going to find a new doctor. And then they do that because a fasting insulin can actually predict type 2 diabetes 10 years before the patient even develops it. And the average doctor doesn't know that. But when a doctor has got 3 or 4 patients who've seen my YouTube videos and they're like, no, you're going to check a fasting insulin. And then they do that, and then they see that, they might start checking fasting insulins on other people as well. And when they see somebody with a fasting insulin of 30, 40, 50, 60, 70, and that's very common for people eating a high carbohydrate diet, they can actually catch somebody who's on the direct route to developing type 2 diabetes and say, hey, lower get rid of all the starches and desserts and stuff and fruit juices, and boom, the fasting insulin comes back down, either normal or near normal. Well, you just added another 20 years to that person's life before they develop type 2 diabetes. And once doctors see the utility of a fasting insulin, they start checking it on everybody because it gives you a 10-year look into the future at what's going to happen to that patient's metabolic health. And most doctors are very happy once they get it. Once they understand what's going on, they're very happy to have that tool, and they start checking fasting insulins on everyone. But many doctors practicing right now today in 2023 are not going to check a fasting insulin unless you're prepared to stand up for your patient rights and your human rights and say, no, you either check it or I'm going to find another doctor.
Yeah, it's important we're getting into all this nuance because, like you're saying there, somebody's blood sugar can be awry for like 10 years and they're building up insulin resistance. The body's compensating by producing more insulin, keeping the blood sugar down, making it look like everything's good. But right away, if you trump all those other tests and go right to the fasting insulin, you can see what's happening years before. So just highlighting there and expanding upon that because of the importance.
Absolutely. And there's also checking a patient's triglycerides, which many doctors do, but they don't check it in concert with the fasting insulin. And so many patients have been told, many people in our private group, their doctor literally told them, look, your triglycerides are 400, 500, 600. You've got to cut back on the animal meat, the red meat, the saturated fat. And once the patient understands through our teachings what actually causes an elevation in triglycerides, they're like, how does a board certified medical doctor not know that saturated fat doesn't increase your triglycerides? That's not what does it. It's carbohydrates, and your body's attempting to turn that into triglycerides and then store that as fat in your body. That's where high triglycerides come from. But the average doctor, once they get through their third year of medical school, this is very important for everybody to understand. Up until the third year of medical school, anatomy and physiology, biochemistry, cell and molecular biology is pounded into their little medical school student brain. But starting the third year, when they start clinical rotations, the only thing they ever hear about after that till the end of their career in most cases is, what pharmaceutical are you going to prescribe for this? And what dosage? And which one should you not prescribe for this? And they just forget all the physiology because none of the people they look up to, their mentors, their professors, their chief residents, they don't talk about physiology anymore. They just talk about what's the latest and greatest diabetes medication you can prescribe for this patient. And you get points on the clinical rounds if you've prescribed the perfect diabetes medication or the newest diabetes medication. You get points for that. But seldom do you get anything but yelled at if you say, well, now I seem to remember back in my physiology textbook that saturated fat didn't really raise triglycerides. It was the glucose metabolism, carbohydrate metabolism, eating too many carbs. That's what raises triglycerides. You're not going to get a gold star for that in the hospital rounds.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
Any disease you can think of that's chronic and progressive, it's being caused by hyperglycemia, hyperinsulinemia, and chronic inappropriate levels of inflammation. Your default setting is good health. And if you're not enjoying good health,